the Secretary to the Government of the Federation, honorable ministers here present, directors general, ladies and gentlemen. As we begin a new week and the prospects of gradual easing of the lockdown, I wish to start by reminding citizens that this new phase comes with an added responsibility to be extra vigilant and compliant with the accompanying measures and guidelines that are meant to assure that we do not lose the health gains we have made so far, while cautiously opening options for citizens to rebuild their livelihoods. Since our COVID-19 statistics are of considerable concern, attention has also been drawn to the observation that countries who eased or lifted restrictions suffered an increase in new cases. Although our projections already features increasing numbers of cases even before the lockdown, we believe that redoubling our efforts to adhere to government directives can keep figures within control ranges of COVID-19. Over the past few days, case finding has yielded higher figures, such that yesterday, the 3rd of May, 170 persons tested positive, bringing the total to 2,558 confirmed to have COVID-19 in 34 states of the Federation and the Federal Capital Territory. 400 persons have been discharged from treatment, and 87 deaths have sadly been recorded. Of the 170 new cases that came up, there were 39 in Lagos, 29 in Kano, 24 in Ogun, 18 in Bauchi, 15 in Kaduna, 12 each in the FCT and Sokoto, 8 in Katsina, 7 in Borno, 3 in Nasarawa, 2 in Adamawa, and 1 in Oyo State. We can say we are in the community transmission mode, and our strategy is to take all persons who test positive for isolation, even if they have no symptoms, so that they do not run the risk of infecting others who may be more vulnerable due to other diseases which they have. We need to protect not only ourselves, but each other and our loved ones, and make sacrifices today for a better tomorrow. With regard to Kano, the Federal Ministry of Health is strengthening its support for the Kano State Ministry of Health with service delivery and training in consultation with His Excellency the Governor. The setbacks that had been recorded in routine hospital service delivery are being addressed by line experts from the Ministry of Health, working closely with officials of Kano State, whether they are omissions from National Primary Healthcare Development or Department of Family Health. We have sent line officers to go and start rebuilding those service lines. The Federal Ministry of Health pathologist is also participating in the investigation of the unexplained deaths that were reported. The team shall be reinforced according to need, as expressed by the state government, to strengthen its healthcare delivery structure. National Primary Healthcare Development Agency is working with the state primary healthcare and community health workforce to sensitize the population on this infection at grassroots level and to expand our testing capacity. I again call on all citizens to cooperate with health workers and for those testing positive to comply with the invitation to enter isolation. I also call on all healthcare facilities, both private and public, not to reject persons seeking medical help, especially in case of emergencies. It is unethical not to attend to persons in distress, or at least give advice as to what they should do. I also urge citizens to go to the hospital when not feeling well, to cooperate by giving accurate information, especially with regard to their symptoms and also to their travel history. We have indicated interest to the World Health Organization to be part of the global solidarity trial of medicines being tried to tackle COVID-19 pandemic, and efforts to conduct research here in Nigeria are ongoing. Other drugs can be added to the trials based on emerging evidence. In all of this, we shall ensure the maintenance of ethical standards and safety of our people. I wish to again recognize our healthcare workers who are the front lines for your commitment and to reiterate the importance of maintaining high personal safety standards and infection prevention and control protocols at your workplace. This not only protects you, but your family. We shall ensure that more personal protective equipment for you is supplied, and we also urge you to ensure its judicious use. Finally, I thank all citizens for their resilience and endurance over this past week of the lockdown, and that this sacrifice was for the greater good of all of us. Thank you.